Have you ever woken up in the middle of the night feeling a sudden jolt, like your heart just skipped a beat or pounded unusually hard? Maybe it felt like a little electric shock jolted you awake, leaving you lying there, wondering what just happened. If this sounds familiar, you're definitely not alone. Many people, especially those over 60, experience these sudden nighttime sensations, and they can be pretty unsettling. You might even find yourself lying awake, trying to figure out what's going on with your body. But here's the thing. Feeling a sudden jolt at night isn't something to ignore or brush off as just one of those getting older things. It could actually be your body's way of signaling that something's not quite right, especially when it comes to your heart. Our hearts are incredibly resilient, but they're also sensitive to changes in our lifestyle, health, and even the food we eat. So, if your heart's trying to tell you something, it's important to listen. In this video, we're going to explore why some people over 60 feel these sudden jolts at night. We'll discuss what might be causing these sensations, why they could be linked to your heart health, and most importantly, what you can do to address them. Whether it's related to your diet, lifestyle habits, or something else entirely, we'll cover it all. You deserve a good night's sleep without worrying about these unexpected shocks, and we're here to help you find some peace of mind. Now, let's start with something you might not have considered: the role of stress and anxiety. You might think that stress is just something that keeps your mind racing during the day, but it can also sneak up on you at night. When you're feeling stressed, your body releases hormones like adrenaline and cortisol, which can make your heart race or feel irregular. Even if you're lying in bed, trying to relax, your heart might still be on high alert, responding to worries or unresolved emotions from the day. For some people, this can result in what's called a hypnic jerk, that sudden jolt or twitch you feel just as you're falling asleep. It's almost like your body is reminding you that it's not quite ready to rest yet. While these jerks are usually harmless, they can be startling, and if you're already concerned about your heart health, they can feel even more alarming. The good news is that learning to manage stress through calming activities before bed, like gentle stretching, deep breathing, or listening to soothing music, can make a big difference. But stress isn't the only factor. Another major contributor is what you eat before going to bed. You might have heard that heavy meals at night can disrupt your sleep, but did you know that some specific foods can actually affect your heart rate? Caffeine, for instance, is a common culprit. Even if you've cut down on coffee during the day, some teas, chocolates, or even medications contain enough caffeine to keep your heart racing when it's time to wind down. Then there's sugar. A late-night dessert might sound comforting, but sugar can spike your blood glucose levels and, in turn, your heart rate. That sudden rush of energy can lead to palpitations or that jolting sensation when you're trying to sleep. Keeping your evening snacks light, balanced, and low in sugar can help prevent this uncomfortable feeling. Another surprising factor is dehydration. You might not think that going to bed a little thirsty could affect your heart, but staying on your heart can sometimes manifest as palpitations or those sudden jolts at night. Drinking a glass of water an hour or so before bed can help ensure your body stays hydrated without causing you to wake up frequently to use the bathroom. It's all about finding that balance between staying hydrated and not disrupting your sleep. Now, let's talk about a factor that often gets overlooked: medication. As we age, our bodies process medications differently, and some prescriptions, especially those for blood pressure or heart conditions, can have side effects that impact your heart rate. For example, certain beta blockers or calcium channel blockers might slow your heart rate too much during the night, causing that strange, jarring sensation when your body tries to compensate. On the other hand, some medications might stimulate your nervous system, making your heart rate rise unexpectedly. If you've noticed these nighttime jolts shortly after starting a new medication or changing your dosage, it's worth discussing with your healthcare provider. They can help you figure out whether your prescriptions might be contributing to the problem and possibly adjust your regimen to minimize side effects. And let's not forget the role of sleep apnea. This condition, which causes brief interruptions in breathing during sleep, is surprisingly common among older adults. When your breathing stops momentarily, your body responds by signaling your heart to beat faster, creating that sudden, alarming jolt that wakes you up. If you or someone close to you has noticed loud snoring or gasping sounds during the night, it might be worth getting evaluated for sleep apnea. Treatments like a CPAP machine can make a world of difference, not just for your sleep quality but also for your heart health. As we continue to explore this topic, it's essential to remember that your heart's well-being is closely linked to your overall lifestyle. Sometimes, it's not just one factor but a combination of stress, diet, hydration, medication, and underlying conditions that come together to create these unsettling nighttime jolts. That's why taking a holistic approach, one that addresses both your physical and emotional well-being, can make a significant difference. One simple change you can make right now is to develop a calming bedtime routine. Maybe it's as simple as dimming the lights, doing a few minutes of gentle stretching, and sipping on a warm, caffeine-free herbal tea. Reducing screen time before bed can also help. Those glowing screens can interfere with melatonin production, making it harder for your body to relax and your heart rate to stabilize. You might also consider keeping a journal by your bedside. Writing down your thoughts and worries before you sleep can help clear your mind and reduce that lingering stress that sometimes triggers those nighttime heart jolts. Plus, journaling can help you track patterns, like noticing if certain foods or activities seem to make the problem worse. If you're someone who enjoys a bit of late-night TV or scrolling through your phone, try switching to something less stimulating, like listening to a calming podcast or reading a few pages of a good book. The goal is to ease your body into a restful state, rather than keeping your heart and mind racing right up until the moment you lie down. And finally, it's essential to remember that while occasional jolts might be harmless, frequent or intense episodes shouldn't be ignored. Your heart is an incredible, hard-working organ, and any significant changes in how it feels, especially at night, warrant attention. It's always better to have a conversation with your doctor to rule out any serious issues. Sometimes just knowing what's going on can ease your mind and help you sleep more peacefully. We'll continue exploring more practical tips and insights in the next part of this video, so make sure to stay with us. Taking small, intentional steps can make a big difference in how you feel, both physically and emotionally. Your health and well-being matter, and we're here to support you on this journey. Now, let's shift our focus a bit and talk about something that many people don't always consider: how your sleeping position might be contributing to those sudden nighttime jolts. Believe it or not, the way you position your body can have a significant impact on your heart rate and overall comfort during sleep. For example, sleeping on your back might cause your tongue and soft tissues to collapse backward, partially blocking your airway. This can lead to disrupted breathing, and when your body senses a lack of oxygen, it signals your heart to work harder, potentially causing that sudden, jolting sensation. If you're prone to this, try sleeping on your side instead. Many people find that side sleeping not only reduces the risk of sleep apnea, but also helps maintain a steadier heart rate throughout the night. Another tip is to elevate your upper body slightly using a wedge pillow or by slightly raising the head of your bed. This position can help reduce acid reflux and improve breathing, which in turn can decrease the chances of those startling heart jolts. Experiment with different pillow setups to find what works best for you. Let's not overlook the role of body temperature either. Feeling too hot or too cold at night can put stress on your cardiovascular system. Your body works hard to maintain a stable core temperature, and if your bedroom is too warm or too chilly, Your heart rate might fluctuate as your body tries to adjust. Ideally, keep your room at a comfortable, cool temperature, around 65 degrees Fahrenheit, 18 degrees Celsius, is often recommended for optimal sleep. Wearing breathable, loose-fitting sleepwear made from natural fabrics like cotton can also help keep your body temperature stable. Sometimes, nighttime heart jolts can also be linked to something as simple as restless leg syndrome, RLS. If you find that your legs are twitchy or uncomfortable when you're trying to fall asleep, it could be affecting your heart rate as well. RLS can be triggered by a deficiency in certain minerals, like iron or magnesium, so consider discussing this with your doctor. Sometimes, incorporating foods rich in these minerals or taking a supplement can make a difference. Speaking of nutrients, potassium is another key player here. Low potassium levels can sometimes cause irregular heart rhythms, and since potassium helps regulate muscle contractions, including your heart, it's essential to make sure you're getting enough. Foods like bananas, sweet potatoes, and spinach are excellent sources. Adding these to your meals, especially in the evening, might help. Another practical tip is to practice relaxation techniques before bed. Even simple deep breathing exercises can help activate your body's parasympathetic nervous system, the part responsible for helping you relax and slow your heart rate. Try inhaling slowly through your nose for a count of 4, holding your breath for another 4 counts, and then exhaling gently through your mouth for a count of 6. Doing this for just a few minutes before bed can help reduce stress and prepare your heart for a calm, restful night. It's also worth mentioning that emotional stress can be a significant factor. If you find yourself lying awake, worrying about the future or replaying the day's events in your mind, your heart might respond by racing or jolting as you drift off. Practicing mindfulness or light meditation before bed can help calm your thoughts and ease the transition into sleep. Guided meditations specifically designed for relaxation can be a helpful tool to incorporate into your bedtime routine. One more thing to consider is how late you're eating dinner. Eating a heavy meal right before bed can not only lead to indigestion but can also increase your heart rate as your body works to digest the food. If possible, try to eat your last meal at least 2 to 3 hours before you plan to sleep. This gives your body time to process the food, so your heart isn't working overtime when you're trying to wind down. And finally, be mindful of stimulants, especially caffeine and nicotine. While it might seem obvious to avoid coffee before bed, caffeine can linger in your system for hours. Even that afternoon cup of tea or chocolate dessert could still be affecting you later at night. Switching to caffeine-free beverages after midday can help reduce the risk of heart rate fluctuations when you're trying to sleep. Nicotine, found in cigarettes and some patches or gums, is also a stimulant that can increase your heart rate and make it harder to relax. If you smoke, consider talking to your healthcare provider about strategies to reduce or quit. Not only can this improve your sleep, but it can also have a positive impact on your overall heart health. It's crucial to approach these sudden nighttime jolts with both curiosity and caution. While they can be unsettling, many causes are manageable with a few lifestyle adjustments. However, always keep in mind that if these jolts become more frequent or severe, it's important to seek medical advice to rule out any underlying heart conditions or other health issues. Remember, your body is constantly communicating with you. Sometimes, these sensations are its way of saying that something needs a bit of attention or adjustment. By tuning in to your habits, listening to your body, and making small, mindful changes, you can support your heart's natural rhythm and find more peaceful nights ahead. You deserve restful, rejuvenating sleep at any age, and taking the time to understand and address these sudden jolts is a step toward better heart health and overall well-being. Let's keep exploring ways to improve your sleep and enhance your quality of life, because feeling good at night means feeling better during the day, 2. Stay with us as we continue to discuss more ways to care for your heart and body. There's so much more to share, and you're not alone on this journey to better sleep and well-being. You've got this. Now that we've explored some of the lifestyle adjustments and common causes behind those sudden nighttime jolts, let's dive deeper into some lesser-known factors that might be playing a role. Sometimes, these sensations are not just about sleep habits or stress. They can be linked to specific health conditions that may need attention. One condition to be aware of is atrial fibrillation, commonly known as AFib. It's an irregular heartbeat that can cause the heart to flutter or race, and it often becomes more common as we age. AFib can sometimes feel like a sudden jolt or a thumping in your chest, especially when you're lying down and your body is at rest. The tricky part is that AFib doesn't always show up during the day, as your busy routine might mask the symptoms. At night, when you're relaxed and more aware of your body, those irregular beats can feel much more pronounced. It's important to understand that AFib itself isn't always immediately dangerous, but it does increase the risk of blood clots, stroke, and other heart complications if left unmanaged. That's why it's crucial to pay attention if these jolts become more frequent or are accompanied by symptoms like dizziness, shortness of breath, or chest pain. If you suspect AFib or have been diagnosed with it, working closely with your healthcare provider to manage it through medication, lifestyle changes, or even procedures can make a world of difference in maintaining your heart health. Another factor to consider is sleep apnea, which we touched on briefly earlier. It's not just about snoring or feeling tired during the day. Sleep apnea actually causes brief pauses in your breathing while you sleep, which can trigger your heart to work harder. These interruptions can result in a surge of adrenaline, causing your heart rate to spike and giving you that sudden shock-like sensation. The problem is that many people with sleep apnea don't even realize they have it. If your partner notices that you snore loudly, gasp, or choke during sleep, it might be time to undergo a sleep study. Treating sleep apnea can significantly reduce these nighttime jolts and improve your overall heart function. Another surprising factor that might cause these nighttime shocks is something called hypnic jerks. These are sudden, involuntary muscle contractions that often happen just as you're drifting off to sleep. It can feel like you're falling or being startled awake, and it's usually harmless. However, when your body is stressed or your sleep schedule is inconsistent, hypnic jerks can become more frequent and intense. While they aren't directly related to heart problems, the adrenaline rush that follows can make your heart race, mimicking that jolting sensation. Reducing stress before bed, practicing calming rituals, and keeping a consistent sleep routine can help minimize these occurrences. Heart palpitations related to anxiety are also a common cause of nighttime jolts. Sometimes, when the day finally quiets down, your mind might start processing worries or unresolved emotions. This mental activity can inadvertently stimulate your sympathetic nervous system, the part responsible for your fight or flight response. As a result, your heart might beat faster or harder, creating that startling feeling. Practicing relaxation techniques like progressive muscle relaxation or guided imagery can help calm your mind and slow your heart rate before bed. One more thing to keep in mind is how dehydration can impact your heart at night. Staying hydrated during the day helps maintain your blood volume and keeps your heart from working too hard. However, if you go to bed slightly dehydrated, your blood may become thicker, requiring your heart to pump harder to circulate it effectively. This strain can sometimes cause palpitations or those sudden shocks as your body tries to adjust. Drinking enough water throughout the day, not just right before bed, can help keep your heart rhythm steady. It's also worth mentioning that certain over-the-counter medications can contribute to nighttime heart jolts. Decongestants, for example, often contain ingredients that can elevate your heart rate. If you're dealing with allergies or a cold, Check the labels and opt for versions that are heart-friendly, especially if you're taking other heart or blood pressure medications. Always consult your healthcare provider before combining different medications to ensure they won't interfere with your heart function. Caffeine is another sneaky culprit. Even if you only drink coffee in the morning, some people are more sensitive to caffeine's lingering effects, which can last well into the evening. If you notice more nighttime jolts on the days you've had that extra cup, it might be worth experimenting with cutting back and seeing if it makes a difference. Another surprising trigger can be changes in your blood sugar levels. For those managing diabetes or prediabetes, a drop in blood sugar during the night can sometimes prompt your body to release stress hormones like adrenaline, leading to a rapid heartbeat or that shocking jolt. If this sounds familiar, talk to your healthcare provider about how to stabilize your blood sugar levels, especially before bedtime. Sometimes a small, balanced snack before sleep can help maintain a steady glucose level and prevent these episodes. Hormonal changes, particularly in older adults, can also play a role. As we age, hormonal fluctuations can affect how our body regulates heart rate and blood pressure. If you're experiencing other symptoms like fatigue, mood changes, or unusual weight fluctuations, it might be helpful to have a checkup to rule out conditions like thyroid imbalances. Your heart health is a multifaceted puzzle, and these nighttime jolts are just one piece. The most important takeaway is to listen to your body and take note of patterns. If these jolts are occasional and brief, lifestyle tweaks might be all you need. But if they're frequent or accompanied by discomfort, it's time to have a conversation with your healthcare provider. They can run tests, such as an ECG or a Holter monitor, to determine whether there's an underlying heart rhythm issue or something else at play. Don't hesitate to advocate for your health. Sometimes, just knowing that these experiences are shared by many can bring a sense of comfort and relief. You're not alone, and taking proactive steps, whether through lifestyle changes or medical guidance, can help you regain confidence in your heart's strength and stability. Remember, your heart works tirelessly for you, day and night. Treating it with care through balanced nutrition, regular movement, stress management, and mindful sleep habits can make a remarkable difference. And as you continue to learn more about your heart health, remember that each small change adds up to a more peaceful night and a healthier life. Stay tuned for more tips on supporting your heart, managing stress, and living vibrantly at any age. You've got the power to take charge of your well-being, and we're here to support you every step of the way.